All right, one of my personal favorite subjects, balance. Now, there's three major points that make up our balance. There's more to it, but I'm just going to focus on the three basic parts that I really enjoy talking about and that I feel are the most important for our balance. One is vision, two is inner ear crystals, and that's what we're going to talk about briefly here in just a moment. And then our third one is our nerves in our joints and tendons that tell us where we're at in space. That's called proprioception. And those are our three biggest major factors for our physical balance. But right now, I just want to talk about one of them, which is our vestibular system. And this is where these inner ear crystals help us with our balance. So as you can see, inside of our inner ear, we have these semicircular canals. We have about 3 of them in different directions. And inside of the canals, you have fluid. And inside that fluid, you have these small, tiny crystals here called otoconia, as you can see right here. I'll zoom in a little bit. And the purpose of these crystals is to communicate to your brain where you're at in space. So inside that fluid, you have hair-like particles that have sensory in it. And when these crystals pass through and touch those hairs, your body can figure out where you're at in space. Now, a cool thing to do to kind of get a better picture of these inner ear crystals is to do something we probably did as a child, which is to spin around in a circle really, really fast and then stop. When you stop and you start walking, doesn't it feel like the earth or the room is kind of swaying back and forth or spinning? We feel off balance. Well, what's causing that is your inner ear crystals. These crystals are floating around, and when you turn around or spin very fast, these crystals start moving faster, and then it takes time for them to slow down and to tell your body where you're at in space. And so while that's happening, your body is having trouble figuring out where you're at. And so that's why you get that feeling of, oh, is the room spinning, or is the room, is the earth tilting? So I find that pretty amazing that we can actually put these things to the test and feel it and see that these things work and they're a part of our amazing and intricate bodies that were created, intricately. Now, sometimes these crystals can dislodge into a canal on accident or by an injury, and that's where we start to get false information as far as where we're at in space. And so a lot of people get vertigo. That's when some of these crystals now accidentally leak into a canal while the other crystals are in another canal, and now our body's having a difficult time detecting what is the truth. What position are we really in? Because we're getting two feedback points, and now our body's having trouble. So to fix some of that, some of our therapists will get a patient in supine. That means getting them on their back and start to tilt their head into certain positions. And then we're able to dislodge or move those crystals back into their normal position. And that's how we fix or help relieve some of the vertigo symptoms that some of our patients have. Now, another thing that could happen is as we get older, these crystals start to kind of break off or chip away. And so tiny particles start to float around in other canals. So that's why some of our elderly friends start to feel a little bit unbalanced or dizzy, or start to get the vertigo symptoms that start increasing as they get older or as we get older. So I think it's an amazing subject. It helps us a lot with our balance, but when it's out of place, it can be very disturbing and painful at times. People will throw up and vomit because their body is just too dizzy to know where it's at in space. And sometimes our treatments may cause a lot of nausea when we're moving and dislodging those particles into the proper canals, that we sometimes have to have a bucket ready for these patients, because more than likely they will vomit, throw up from the unstable feeling that they have. So 3 major points of balance: vision, vestibular, and our nervous system.